Hello everyone. Today let us try to understand what are the effects of these excessive androgen hormones in patients with PCOD. As I told you earlier, the imbalance in the androgen levels and the insulin levels itself is the main cause of the problems in PCOD. So the hormones, the androgen hormone, excessive androgen hormone, which is secreted in the ovary, gets released to the bloodstream. That is how it is going to have the effect on the other parts of the body. The skin and hair are the two most sensitive parts of the body to the effects of androgens. So what happens then? Usually in 70% of the patients, the effects of these androgens on skin and hair is seen in patients with PCOD. So what happens is, one is, as I told you earlier, one is hirsutism, the other one is acne, that is excessive pimples, the other one is pattern baldness and alopecia. So what is hirsutism is because of the effect of these androgen hormones on the hair terminals. There is excessive, like the way the hair grow in a male body, so the same way the hair starts growing in a female body. So like in the area of the mustache, so they'll have excessive hair on the upper lip, and the area near the chin also they will have excessive hair, and also in the mid sternum, the periareolar area, upper back, lower back, near the upper thighs and the legs. So these are all the areas. As per the Ferryman-Galway scoring system, we give the numbers to score the severity of the hirsutism. So this is how the excessive, because of the excess effect of this excess androgens, the hair becomes the thick, as it grows in a male. So the other thing is excessive acne. Some amount of acne is normal in a teenage girls, but when it becomes excess, it appears on the neck, upper chest and upper back also. And usually this type of pimples are resistant to any kind of treatments. Even if you go to the dermatologist, if you take local treatments, topical treatments, and oral antibiotics, usually this kind of pimples, which happens because of the hormonal imbalance, doesn't respond to those kind of treatments. So this is another effect of the excessive androgen hormone in the body. The other thing is the male pattern baldness. So usually the baldness which occurs in males prematurely is because of the excessive effect of the testosterone. So when the same testosterone hormones are increased, the same kind of baldness, the same pattern of baldness and excessive hair loss you see in PCOD girls also. So when you see all these symptoms, we do a blood test to confirm whether the androgen levels are increased or not. So I want to give you two tips when you go to do a blood test for patients with PCOD. The one is, if the girl is already taking some steroids or some hormonal tablets, she needs to stop it for 2 to 3 months before doing this blood test, because these hormonal tablets or the steroids can affect the levels of the testosterone in your body. It may decrease the levels of the hormones, and so when you do the test, you may not get the clear picture of whether she really has excessive androgen hormones in the body. The other thing is, you need to do it at early hours of the morning, like around 7 a.m. or 8 a.m., because the testosterone levels are highest in the body at that time. If you do it at 4 p.m. and all, you may get the levels little lesser, which may mislead you that you may the normal levels may be correct. So that may mislead you from identifying the hyperandrogenism which is present in the girl. So these are the two things which you need to concentrate before you go to the blood test when you have this hormonal imbalance problem, that is PCOD. So what is a solution for this, for these excessive androgen effects? So usually we start with the hormonal tablets, that is combined oral contraceptive pills. So this contains estrogens and progesterones both. So how does it help? So these combined oral contraceptive pills corrects the hormonal imbalance. It reduces the level of insulin levels. It increases the insulin sensitivity. It reduces the levels of testosterone or androgens. It increases the sensitivity, the effect of the insulin hormone. So, and also if you're not planning for pregnancy, it acts as a contraceptive pill also. So, and to see the effects of these hormones on the body, she has to take it at least minimum for 6 months. So even after taking for 6 months, if the effects are not seen, then we will start the next higher level of treatment, that will be anti-androgens. That means they will directly suppress the level of androgens in the body. So sometimes what happens when you're taking these medications, it may correct the hormonal imbalance, but when you stop it, it may slowly, the hormonal imbalance may slowly come back. So in such cases, and also we have seen many girls going for hair removal creams, waxing, threading, and also laser treatment for hair removal, which is also acceptable. But the thing what I want to mention you here is, it will reduce the hair, but it will not correct the hormonal imbalance which is already there in your body. So to correct the hormonal imbalance, as I told you, we need to start the combined oral contraceptive pills and anti-androgens. And apart from that, the most important thing in PCOD, which I've always been telling, is weight loss. That is reduction in your weight if you are obese. So if you do that, more than 50% of the times the hormonal imbalance gets corrected on its own. So this is one thing which I want to tell you again and again and again. Please lose weight if you are obese. The first and foremost and important thing which you need to do in PCOD. So I think for today this is enough. Take care. Bye. If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel and don't forget to press the notification bell.